whatever I was showing you so far, in terms of finding a specific kind of part of the brain, targeting that, finding the specific kind of measurement to be able to change that behavior. And if you want to name it as a biomarker, what would be the right name for that specific biomarker? What do you like to name it that specific? The connection between the frontopolar cortex and amygdala. Or the one that Robin was mentioning in terms of the connection between DLPFC, the most negative connectivity between DLPFC or subgenual cortex, or what Desmond was mentioning about the most positive connectivity between DLPFC and subgenual. What is the best name to name the specific biomarker? Mechanistic biomarker. But there might be something that could be mechanistic but could not be targeted, right? So we want to have something, yes, of course, when we talk about biomarkers, they are all related to mechanism, right? So that is the embedded definition of biomarker. They are related to the mechanism of the disease. But we know that there are things that could be predictive biomarker, but they are not response biomarkers. There are things that are diagnostic biomarkers, but are not response biomarkers. We agree about that, right? So those who are doing neuroimaging, they know that. There are things that people are different because, but if you do an intervention, they are not changing after the intervention, which is, so these things could be overlapping, but many times they are differentiated from each other. So in this specific context, we gap something that we call targeting biomarker. So there is no specific part in that specific pipeline on what we call targeting biomarker. And we define targeting biomarker as a type of biomarker can directly shape or guide or constrain the administration of specific treatment. Okay? In that specific framework, there is nothing about targeting biomarker. So we put together a specific concept note, and we published that in JAMA Psychiatry a few months ago in April. So discussing about targeting biomarker as a framework, and then we approached FDA. And they have been pretty receptive, so we have been discussing. It might be interesting that even in the SANT protocol that has fMRI as a targeting biomarker embedded in that protocol, they have not approached FDA for that specific biomarker. So they approached FDA for that entire package as an intervention, but not specifically for that biomarker. So even that biomarker does not have FDA qualification as a tool, as a measurement. And there are some specific implications for getting FDA qualification for a biomarker. And that is the reason that there is a specific insurance code for SANT protocol, but basically that is integrated with brain stimulation. So there is no separate kind of entity that FDA can consider as a qualified targeted biomarker. And I can go to details of that later on. But that is one side of things that I think we need to think about together. How to interact with the regulatory bodies in the future. How they understand whatever we are doing in the field of brain imaging. And how to approach them to make sure they are not going to ignore us as those who are doing brain imaging in the field. And I told you, even for other biomarkers, response biomarker, predictive biomarker, we have significant amount of data, but nobody put them together and approach FDA and ask the FDA, okay, this is the package, and we want FDA to consider that as a qualified biomarker to be used in the future trials, to be used in diagnostic tools, to be used on clinical work, all those things that could be potentially be done. So that's a kind of interesting thing. I think that for the future, we need to start thinking about how to better interact with regulatory bodies. And I think that even OHBM should start thinking about that in terms of eventually, because at the end of the day, if we want to make any change, we need to be able to bring those things to clinical practice, to be able to make sure that patients are going to use them. Okay, so just wrapping up that first piece.